Hi everyone, welcome to another episode from the UEA's Nursing Podcast. My name's Joe Ellis-Gage, and today we have Katy with us. Hi Katy.
Hi Joe.
So Katy is going to be talking to us about challenging shifts, challenging placements, some of the harder aspects of it. So you've already been in and done a chat about preparing for your first placement, and you had a first placement that went really well, but sometimes you have placements that are rockier. And it might be that you have a great placement but you have a bad shift, or you might have a whole placement that's just a bit harder or not quite your area or whatever, that makes it a bit of a challenge. And it would be a surprise if you went through 3 years of training and every placement was absolutely smooth and every shift was fine. That isn't the reality of it. So that's why I think it's important that we have a chat, and some students will watch this ahead of a placement, or some people might watch this after they've had a rocky couple of shifts, or in the middle of a placement they're not enjoying so much, and they might just find this useful and hopefully reassuring. So to start with, tell us about a couple of the challenges. What were some of the examples of challenges that you came across on placement that were unexpected or a bit harder than you were thinking they would be?
Okay, so from a children's nursing point of view, you're not just looking after a child, you're also looking after their family. It's probably one of their most vulnerable times. And I had a parent who was particularly challenging, I suppose. I can't fault the patient. The patient was very cooperative. But the parent, it's as though she was, I don't know, she was throwing a few spanners in the works, and I wasn't able to help her where she needed the help.
Okay.
So I think this was my second shift actually, and I went in very enthusiastic, trying to help as much as possible, and I couldn't give her the answers that she wanted. So I'd gone in, introduced myself to both mum and child, did a set of obs, filled in the relevant paperwork that I needed to fill in, and I said, I'll be back in a little bit, and because child was due to go for surgery. And straight away, how long is it going to be? I said, I'm really sorry, I can't help you. I don't actually know the answer. There's a few patients on the surgery list, and I can go and find out for you, or I can go and see if I can find out for you. And lo and behold, there is no time.
So it's a bit of an unknown, isn't it? You never know quite when surgery's going to happen. How long did the previous one take before you were on the list? Delays, all that. Yeah.
So she wasn't kind of very happy with the answer, but she took it, and so anyway, there was a few occurrences of her ringing the buzzer, and I went in, kind of tried to, again, answer more questions that she had. And I said to her, tell you what, and I got my notebook out.
Notebook's important, yeah.
Yeah, and I said, I'll tell you what, I said, you tell me what your worries are, you tell me what your concerns are, I'll write down everything that you kind of want answering. I am going to have to take it away and get the nurse that's in charge of this area, and I'll see if I can help you. And she seemed really grateful for that, and I was like, okay, maybe I'm kind of...
You're winning her over, yeah.
Like maybe it's like, kindness is working. Not that you shouldn't be kind to your patients and families, but,
yeah,
I felt like I was kind of going quite out of my way to try and accommodate her as best as I could. So I took these questions away, went and found the nurse that I was kind of buddied up with for the day, and she was in the middle of a drugs round. I was like, oh God, okay. And I kind of said, I'm really sorry to interrupt you, but this patient's mum, she's got lots of questions. And nurse was really, really busy in the middle of a drugs round. You really kind of don't want to interrupt someone when in the middle of a drugs round. And she went, I can't deal with it at the moment. You're going to have to just go and say to her, I'm busy. Okay, no, that's fine. I go back up the other end of the board. Hi, really sorry. I haven't actually got any answer at the moment. And the nurse who's helping me look after your child today, she's busy doing a drug round. Well, that was it. She flew off the handle, and she kind of let go. And I was like, and I just stood there, and I let her talk it out, like, just let her go. I was like, I've got to stay professional the whole way through. And I said to her, I understand your concerns. She'll be in when she'll be in, sort of thing. She's doing a drug round. It wasn't anything that needed to be dealt with urgently. It was just kind of concerns and worries that she had. But I think it was that thing of her child obviously is number one, and her child is important, and she wants the answers and everything sorted out, which I understood. And as I left the room. I'm not going to lie, my eyes filled up with tears, and I went and hid around the other side of the drugs area. And I was then quickly pulled into the staff room and it was like, you need to have a bit of time out. And I let go. I bawled my eyes out, and I felt better for it. And the sister of the ward then came in. It very quickly kind of circulated around the ward that the students upset.
Okay.
Which was absolutely fine. It didn't bother me whatsoever. It was actually kind of nice that they wanted to look, they want to look after their patients, but actually they've got to look after, like, the students of the workforce of the future.
Yeah, they've got to look after you as well.
Yeah, and they want to look after everyone. You look after, you look out for each other. So your sister of the ward came in, kind of had a good chat with me, made sure that I was okay. And she said, look, don't worry about it. And she made sure that I was happy with the plan that we kind of put in place. Said, just if you're not happy doing it, you don't do it. That's it, simple as. And she made the nurses aware at the other end of the ward. And she did go and speak to the parent as well. But yeah, the thing is, it wasn't aimed personally at me. And I think that's the thing. If you have a challenging patient or a challenging family member, it's not personally aimed at you. You need to not take it personally. But also on the other kind of flip side of it, it's natural for you to get emotional. Like if someone's, if you've got someone shouting at you, or someone really kind of, you can see that they're very clearly worried and upset. And if anything, let them have their say, and then take it. Like, let them have their say and say, okay, I'll come back in a little while. Let them calm down, and then you take those concerns away and you try and see if someone can help you deal with them. Yeah,
and in a way, it's kind of lots of the concerns these parents, and it'll be the same with partners of adult patients and parent or family members, wider family members. At that point in time, their priority is their relative who's unwell. People are often far more worried about someone else in their family than they are about themselves. Mm-hmm. And that's why they can be a bit demanding, but they often don't realise when they cross from reasonable level of demanding into slightly more unreasonable grounds.
Yeah.
And it's hard to balance the bigger picture. And you want to say to them, there's other things going on, that's why you need to wait.
Yeah.
But you want to remain professional at the same time. And that's a tricky line to tread, especially on your second shift.
Second shift, second placement in a total new clinical area that you've never stepped foot in before. Yeah.
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 And you're more anxious about saying the wrong thing, so you end up saying nothing because you haven't got any answers. Yeah. And I guess when you got upset, it wasn't aimed at you in any way, but you were just like, I've come here to help people. I'm trying to do my job and I can't.
It's not being accepted.
Yeah. I'm doing the best I can.
Yeah.
So, and what happened after that? So how did you feel later on in that shift or by the end of the shift?
I'm not gonna lie, I felt kind of a bit out of sorts. I'd had my feathers ruffled, and I didn't expect it to happen.
Yeah.
These sort of things, you can't expect them to happen. Like, it's the nature of the job. You're dealing with vulnerable people and tricky situations. But I spoke to friends that I've got, and they said to me straight away, they were like, obviously I didn't tell them the nitty gritty details, but I kind of said that I've had a bit of a troubling shift, and they said you need to speak to a link lecturer, you need to make the university aware. And I was like, but it's kind of, I feel like I'm making making a big deal out of something that's really small. And they're like, well, no, if you're feeling that way, then you definitely need to make someone aware about it. So straight away I sent academic advisor, or I did one email to academic advisor, link lecturer, and I copied the clinical educator in as well. Just kind of made them aware of my worries, and the support is there. I reached out, got the support that I needed, and all kind of like throughout that placement, then I felt like I was getting the regular support that I needed. I don't know whether or not I'm just, as a person, I'm more sensitive, or I just need a bit more support in different areas. Yeah. Everyone's different.
Yeah. And actually, although you could easily have kind of gone, it's one bad day, there's an element of knowing when you need to ask for help. And if you're feeling like you haven't quite had the support, and you're on a busy unit, everyone's doing lots of different jobs, and you've kind of been left there, that will inevitably happen. Mm-hmm. But the units do need to know if they if they need to support a student a bit more or give them a bit more guidance, and also to look after you on future shifts, because you might come across a similar situation again.
Yeah, definitely. Yeah, and I think that then actually radiated through for the rest of my placement. Okay, I was only 2 shifts in, but I noticed a significant difference from both the clinical side of study and university support as well.
Yeah.
So yeah, if it's even if it's the smallest little thing, you're better off telling someone rather than holding it in. Bottling it up and holding it in isn't actually going to do yourself any favours. You need to reach out and get.
And sometimes that all you're doing is telling someone, and they go, "Okay, thanks for letting me know.
Mm-hmm.
We're here if you need anything."
Yeah.
You don't need anything at that point, but you crack on. But you've already voiced it. You've raised your concerns. We can't just fix everything straight away, but just sharing it is useful. And there is support for students on placement. And I think sometimes students on placement feel a bit lost, because in uni you're seeing lecturers every day or every week, and then you go out and you go, right, you're off for 8 weeks, and you're not left off for 8 weeks, but we can't be everywhere all the time. And unless students contact you and ask for a bit of help, you tend to assume, whether it's us or the clinical educators on the units, tend to assume people are doing all right. So that asking for help is really, really important.
Definitely, yeah, definitely.
And then one of the other things you mentioned to me about on placement and being a bit challenging was building your confidence up to put yourself out of your comfort zone.
Yeah.
So not necessarily a challenge in that you'd done anything wrong or that you had another complicated case, but more a case of, to get the most out of your placement, you felt like you weren't, because you were keeping yourself in kind of the safe zone.
Yep. Yeah. So I was desperate to get into theatres. I really wanted to do a theatre journey. And I probably didn't make the team aware, maybe, or made the nurses in charge aware, possibly. Maybe I didn't do that enough. I'm laughing about it now. There was a child that was going down for theatre. I'd done, and this is what the frustrating thing is for me, because I'd done all the care before. So, done all the admission paperwork for surgery, done all the obs, done all those bits and bobs, and then got the gown and everything, got patient ready for surgery, and then one of the theatre staff comes up, and he's in his green scrubs, hat and everything. I'm like, "Oh," I said, "Are you here for so and so?" "Yep. We're just gonna finish sorting out the paperwork." "Okay, great. Can I join? Like, can I come down to theatre?" "Oh no, it's not me. You need to ask." And I was like, "Oh God, okay." I said, "I'm a student nurse. I'm a first year, so I don't really know who the right person is to ask."
Yeah.
Because I thought I'd take it upon myself to ask rather than relying on a nurse. I thought,
proactive about
come on,
it.
I can do this. Yeah. So for him to then turn around and go, "I'm not the person you need to ask. You need to ask Mr. So and so, who is a surgeon." I was like, "Oh, okay." But because he was in such a hurry, I didn't go, "Oh, who is he?" or "What?" I didn't.
How do you ask him? Where is he?
I didn't even say, "Oh, what does he look like?" And all of a sudden, he's wheeled down to surgery. I was like, "Oh no, I've missed out my chance." And then I did all post-surgery care as well. Did all the discharge. So I'd done everything
apart from the bit in the middle you really wanted to do as well.
Yeah. So yeah, it's really crucial that you do definitely push yourself out of your comfort zone, and you've got to you have got to be proactive about it. I thought I'd been really proactive, clearly hadn't been proactive enough, and missed out on an opportunity.
Yeah, I mean, maybe that's just bad luck as to who you spoke to, perhaps, but you could have, I suppose, have said earlier on in the day, before that theatre worker had come up to kind of come and collect the child, "I really want to do this. Speak to your nurse supervisor and say, who shall I check with?" And they might not know the answer, but they'd probably say, "Well, let's go down to theatres and go and ask," and you could probably find whoever was in charge for the day and get the ball rolling a little bit
sooner,
earlier than a quick last minute thing. But you do get more out of your placement when you put yourself out of your comfort zone and you go and do
things that you wouldn't expect yourself to be able to do as well. Yeah.
And otherwise you end up just doing the things that you feel comfortable with, and you get really confident at those, but you don't do lots of the extra skills and extra sort of elements of the role.
Yeah.
I remember when I was a student nurse, I don't really remember it at the time, but I was clearly reasonable at asking for when I wanted to do something. And I remember being on neonatal intensive care, and I'd been saying to my supervisor or mentor that I wanted to do, it'd be really good to be involved in a transfer, because babies would go down for MRI scans and it's a complicated business to take a ventilated baby into an incubator to then transfer through the hospital and all that. And I said, I'd be really interested. I wasn't particularly pushy about it, but I remember having a conversation saying, that would be really good at some point to be involved in, so I can see the technical aspects of it and help out. And then when I was on shift one day, and my supervisor came and she went, "Oh, Joe, they're doing a transfer down to MRI. Do you want to go?" I was like, yeah, okay. Yeah. So she knew I wanted to do it. She came and found me. She sent me in there, and I kind of went with this nurse, and we started doing all the different bits. And she was saying, "This is the transport incubator. This is the ventilator. This is what we do. We have to do these checks before we go. We have to do this. Did a down, and it's not a quick process. So I was gone for quite a long time. The child went through, had the scan, got sorted out, but back in, transferred all the way back up, came back up. And when I got back up, a friend of mine who was a student nurse was out there, and she was just looking at me. She's furious. I was like, all right. Just pulled this face at me. She'd been looking after that baby that day up until the point where they went down for the scan.
Oh,
I had no idea.
Talk about treading on toes.
Because I'd been clearly sort of said, "Oh, I want to do that." Someone had gone and found me and gone in there, and she'd kind of just quietly been getting on with her shift and would probably naturally have assumed she was going to go down there.
Oh no!
She got left behind. So then she got over it after a couple of months. But it shows you that kind of, if you put yourself out there, you will get more out of it. And you don't want to be taking other people's patients to fit off places when you shouldn't be.
Yeah.
But it shows you that you can get more out of it.
Yeah.
And how did you suddenly? You said you changed. You went from going. Probably you were hit back from that first early shift of losing a bit of confidence to then finding a small sort of comfort zone for a bit, and then you made a decision. You sort of then stepped forward. How did you do that? What did you do differently to get more out of the placement?
I tried to take each shift as it came. I tried not to let that shift hinder my experience further, like for the rest of the placement. I kind of said to myself, wrong place, wrong time. And it was just an unfortunate event that happened. So I'd always try and go into each shift enthusiastic, or as enthusiastic as I could. You can't predict these sort of things that are going to happen. These challenging events, shifts, placements, they are going to happen, but it's the way that you deal with it in order to push yourself forward. But yeah, I did. I just took each shift as it came, and I took learning experience from it.
Yeah.
But yeah, it's I'm not gonna lie, it's tough. It's tough, and you have to think to yourself, you're only human.
Yeah.
Your emotions will be all over the shop. One minute you'll have a high, then you will have that anxiety, nerves, and emotions might kick in.
Yeah.
But if you need the support, you reach out for the support. So.
And do you think you found it harder because you'd had such a good experience in your previous placement that you were then comparing?
Yeah.
Yeah.
I probably shouldn't say yeah, because it's that thing of like...
But I think it's natural that students will always enjoy one placement more than another, and there'll be someone else who did exactly the same pathway as you who enjoyed the second placement and got more out of it than the first, just because of circumstance and the nature of what they're interested in. So that's okay.
Yeah.
But yeah, sometimes you end up comparing your favourite placement to the other ones.
And I think actually the other thing is you can compare your experience to someone else's. A lot of us, we were so excited to have our first placement through. And then, so, you do your first placement. And then when you go to your second placement, it's like, oh, hang on a minute. So-and-so went to this placement area. Didn't they say this?
Okay.
Or, oh, who was their assessor? I wonder if their assessor and supervisor is the same as mine. So then you kind of get chatting with each other. And you're like, and then you hear of each other's experiences. But the key thing is don't let someone else's experience taint your experience. So if someone goes, oh yeah, I love this placement area. This was, I got this out of it. I met this person, did this. Don't set your expectations the same as. Yeah,
don't assume you're going to have all the same learning opportunities without putting yourself out there and doing it.
Exactly.
And the same, if someone has a negative story about a placement area, it doesn't mean you're going to have the same.
No, that's it. And this is the thing. As humans, we always naturally seem to focus on the negative thing. You always hear about the negative thing. Don't let those things put you off. Yeah.
And you can learn as much from a placement you deem to be a more negative one, a worse placement.
Definitely.
A placement you don't enjoy as much.
Yeah. But
you'll come out of it the other end and go, well, I got through it and I've learned loads.
Yeah.
And I'm probably more resilient for it.
That totally. Yeah, I totally agree with you. Yeah.
Okay. Well, thank you for telling us about your kind of experience there. I'm sure lots of people who've watched will have similar experiences of challenging shifts or challenging placements, and be reassured by the fact that you can come out the other side of it and be looking forward to your next placement, which is in just a couple of weeks' time.
Yep.
Excellent. All right. Well, thank you very much for coming in. Thank you for watching. Please like and share the video if you think it might be useful to others. Subscribe to the channel so you get alerts when there are more videos, and add any comments or questions below if you've got anything you want to ask, and we will hopefully see you when you come and watch another episode. Thanks very much.
Thank you.
Thanks.